Good evening. Good evening. I am Ellis Dean, and I am a senior project manager with BlackDoctor.org. And as you know, this is our show that we like to call Black Doctor Speak, where we bring you the news and we have you talk to medical professionals to get your questions answered and give you information directly from top medical professionals. This show, that first show after what happened in DC on January 6th, we'll call it what it is, the terrorist attack on our Capitol in D.C. And we want to take a few moments before we get into tonight's discussion. We'll take a few moments to kind of talk about what happened and the impact. So, as always, we have the loquacious uh, Dr. Michael LeNoir. Dr. LeNoir, how are you?
All right, well, welcome to today's program. I think that it would be remiss if we didn't realize that the health of the nation affects the health of us all. And what we saw this past week was just absolutely unbelievable.
Yeah.
I mean, it was actually a coup. They didn't want to call it a coup d'état, but it was clearly a coup d'état. We've had demonstrations in this country all summer long for a variety of different realistic issues around Black Lives Matter. We're fighting for justice. They're fighting against it. And so this week was a very impressive week. I believe, Ellis, I don't know, and maybe you want to bring Dr. Bashard into this. I don't believe that if it had been Black people, there'd probably been 40, 50 people dead on that moment.
I don't know about that many being dead, but I do think that the response would have been different. I think the response would have been much faster. It would have been much more aggressive. It would have been much more swift. And I don't think that the participants would have gotten as far as they did and would have been able to linger as long as they did in the Capitol and in the chambers of Congress, being able to break into individual Congress members' offices the way that they did. So I do think that if there was a different hue to the people that were participating in the riot, I think the outcome would have been very, very different.
I don't know. I think also that as I see it right now, I think that they made their move too soon. Quote B.B. King, I think they made their move too soon because I think they scared everybody this time. Because there would be no way in which the people who got into the chamber would have been able to distinguish Republicans from Democrats. They really didn't know that. The other thing that I think from a health perspective that is really quite remarkable and brings up this whole issue of what wearing a mask means and how that many of the supporters feel that's a badge of honor. Two of the Democratic congresspersons were sequestered in a room with three of the Republicans who refused to wear a mask. And now those Congress people have coronavirus positive infections. And so, I just think it shows a lot about what's happening. We'll talk more about the coronavirus as we go further along, but I do think that this was a wake-up call for the mental instability of this country. And I just hope that coming out on the other side that he made just enough mistakes that it will ultimately seal his fate. And I think that maybe we were very close to being an autocratic country.
Yeah, I think that for our audience of people that are watching, I think the words that you need to look up are sedition, which is what happened when they planned it, and insurrection, which is what happened when they executed it. And that is when you're rising up against your own government. Those are serious charges that, and including some Congress members, people that encouraged this type of action amongst the crowd, and so they need to face those charges as well. I think ultimately what we have to really be cognizant of is when you have, and I think the people that the rest of America that watch this in horror, they realize that those people were acting that way based on a lie, based on what they wanted and not based on reality or facts. And so I think everybody had that moment of realization that if they can behave this way off of a lie, they can create that lie about anyone or anything or any group or anybody if they were able to take power, and they could use that same kind of bully mentality against anyone that they don't like or they don't feel that is fully supporting them and what they believe. And so that's the scariest part about that whole situation. And we can talk about, we probably need to do a show on mental health and delusion.
Well, I think it's been very much a roller coaster ride
Yes, sir.
for Black people. But let's move now into our guest. I brought this topic up because I never thought that we would have to discuss this. We all know that for various races in this country, that the health outcomes are very different. For African Americans, if you look from the cradle to the grave, that we die more often and we're sick more diseases than any other ethnic group. In my own area of Oakland, between less than a mile and a half from here, where the zip code changes, the life expectancy of a Black man is 7 years less. And so consequently, I always thought that race as a parameter for research was a critical issue. But no, that apparently is not the case. There are a group of people around the country who argue that race is such a spurless social construct that it is not a legitimate dynamic. It's not a legitimate parameter for measuring issues around health. And so I'm brought to the table one of the world's most important researchers, Dr. Esteban Richard. Dr. Richard is a San Francisco native, grew up in a very poor neighborhood, but ultimately graduated from Stanford and Harvard, and as at one time, as he informed me recently, been replaced. The youngest full professor, endowed professor, University of California. Many of his studies have involved race, and so we brought him to the discussion. Here, let me just outline the argument. The argument that comes from the academic community, the academic community, is race is such a spiritless thing, that race ordinarily is self-described and may not represent the genome that you are looking at in terms of its outcomes for diseases. Now, we know two things. We know A, self-described African Americans are self-described. And generally, even if you're not self-described, they self-describe you. We also know that at the end of the day, a self-described race of African Americans has poor outcomes. So what happens in the middle is where the discussion lies. And so we want to welcome you to this discussion, Dr. Richard. First of all, you are probably, and I'm exaggerating, one of the world's foremost experts in the impact of race on certain diseases, certainly in asthma. Tell us a little bit about your research, how you got interested in it, and what it ultimately revealed, and how it made a tremendous impact on how asthma is looked at in this country and its management.
Mm-hmm. Well, thank you. Thank you for having me on, Dr. LeNoir and Ellis, Mr. Dean. Thank you for having me on. I'm Mexican, and I grew up in a multiracial household. My mom was very dark-skinned, almost looking African American, didn't speak English, was a farm worker, and we grew up in primarily Latino and African American neighborhood. And so the idea of race has always been on my mind since I was born. I grew up in a poor environment and fatherless, and found my way through academics and school through sports. My wrestling coaches were African American on the 84 and 88 Olympic teams, and you couldn't have had a better role model. So I did very well in school, and I was interested in genetics, and I went to medical school and studied genetics there. Wasn't totally thrilled about what I was doing, and when I got to Harvard, I got involved in a project studying asthma severity between whites and African Americans, and we identified a gene that was associated with asthma severity, but it was 40% more common in African Americans than whites. And that was the first time in my life that these social, what has been labeled social disparities, actually had a biologic basis.
Share some of those statistics with us, so that our audience understands how much more at risk African Americans and certain Latino populations are at risk for serious asthma.
So asthma is a fascinating disease. It's the most common chronic disease of children. And the prevalence rate varies dramatically. So about 25% of Puerto Rican children have asthma. About 15% of African American children have asthma. About 8% of whites have asthma. And about 5% of Mexicans have asthma. But when we look at death rates are highest, about fourfold higher in African Americans and Puerto Ricans than they are in whites. But when we look at where the United States federal government puts their research dollars, 95% of all lung research, including asthma, has focused in on white populations. When we look at genetic studies, and there's been a tremendous genetic revolution in the last 30 years, 95% of all modern genetic studies have focused in on whites. Whites only make up 12% of the world population. That means 88% of the world is not benefiting from tremendous advances in modern science and medicine and genetics and cancer therapies and therapies for lots of other diseases.
So when you started looking at asthma and you looked at genetics, what'd you find?
Oh, we found incredible factors that were related to asthma. Number one, your zip code is, as you alluded to, is probably stronger than your genetic code on how your health will manifest. So we know that poverty is a big predictor of asthma. We know that poverty and stress makes asthma worse. We know that there are genes for asthma. We know that asthma runs in families. And we know that the populations with the highest prevalence and death rates from asthma have a lower drug response to commonly used asthma medications.
So what you're saying is that, let's take the most commonly used asthma medication, which is albuterol. Everybody doesn't respond to albuterol the same way, even though doctors prescribe it very similarly for all populations.
That's true. And we published that with your help. We compared the drug response amongst children with asthma and demonstrated that African American and Puerto Rican children, who incidentally have the highest death rates from asthma, have the lowest drug response. And the big company, GlaxoSmithKline, demonstrated that as well, that African Americans taking their drug at the time, which was called Ceravent, had a 7-fold higher death rate than whites taking that same drug.
Now, our special guest, Dr. Esteban Bouchard, geneticist, a researcher, physician, a pulmonary specialist. If you want to join our conversation, get in the chat room to ask questions. We're getting to the point, which is the issue of race and research. Now, I never thought that because I know these statistics and because I know the outcomes and the differences among the various self-described races, I never thought that would be challenged. But certainly the academic community has challenged the fact that race is so iffy, to use a non-scientific term, that it's not really stable enough to use as a research tool. What bothers me about that whole concept is that we know certain races have poor outcomes. We know that there are various races, and I thought that would never be challenged. Why was that challenged?
A couple of reasons. Number one, there in the United States, there's two Americas, and you have seen that on full display. And I think as minority citizens, we've always felt that. We've seen it. We've witnessed it. We've said it. And a whole side of America didn't believe it. But today, this week, it was on full display. And this year, it was on full display. And Fortunately for the iPhone, we captured it all on video. Ahmaud Arbery, I'm sorry, Breonna Taylor, George Floyd, they really show you what it's like to be black in America. And that has nothing to do with genetics. It has nothing to do with biology, but it's clearly a social determinant of the longevity of your life. And clearly being black affected them. So let's agree on that. But what you're saying is that when we talk about longevity and lifespan, my question is, are there any biologic components to it? And it's pretty clear that there are. We know that prostate cancer is 2 times higher in African Americans compared to white men. We've identified all the genes that explain prostate cancer in African Americans. But African Americans still have poor outcomes, even though we know the cause. And the reason for that is that African Americans in the healthcare system of the United States do not get treated the same as whites.
And so what you're saying is that all of the constructs that we talk about leading to outcomes, some of them obviously are biologic, but
Yep.
some of them, like racism, I mean, look, racism has worn me down the last couple of weeks. I mean, we stayed up all night waiting to see what happened in Georgia. I mean, racism has just worn us down and has a kind of a non-measurable, often non-measurable impact on outcomes. So the opposition says that that's not important. That's not important in science. Is that self-described African Americans are not always, if you look at the genetic, and some of your research, I think to be fair, suggests that you can't tell how much African American, how much African is in an African American.
Mm-hmm. So let's use President Obama as an example. Number one, he is brilliant. I got to meet him. He was a great president. He's half white and half black. The police would automatically label him as a black man. Healthcare providers would label him as a black man. When I had a firefighter come to my office as a pulmonary physician who had toxic smoke inhalation, he wanted to be evaluated for disability, and the insurance companies didn't want to pay. And being from the hood, I knew how to code switch. And so when I was doing the test for him, I said, "Hey, man, are you a brother or not?" He goes, "I'm half." And that actually began my journey, because if we compared them to white patients, we would get one reference value. If we compared them to African Americans, we get another one.
Let's not lose people. One reference value for his lung function.
For lung function, yes.
Right. And so that the race issue for you obviously means an awful lot in terms of how you are able to analyze data. The other criticism of the opposition is that if you make that mistake, and let's say you have someone, and when we looked at the African American population, we were really quite surprised. Probably the only thing that correlated was not so much genetics, but skin color, because that's the way we're evaluated in this country as to whether we're black or white. It doesn't matter, what you say. I'm Seminole, Blackfoot. That old Blackfoot Ellis. You ask any brother, but I don't know why we want to be more Indian, and they're worse off than we are. But when you talk about what the genetics are, that you can't really tell by looking at a person exactly what percentage is African American, what percentage is Caucasian, what percentage is Indian. Mm-hmm. So that if that's the case, they maintain that too often when we make decisions based on race, not only do we put people in a discriminatory category, but sometimes we overtreat them or undertreat them on the wrong parameter.
Exactly. And there have been significant advances in our understanding of science in the last 20 years since the completion of the Human Genome Project, that now we can estimate exactly what you are. So there's companies, AfricanAncestry.com, Ancestry.com, 23andMe. Big proponent of this is Skip Gates, where we can tell you exactly what you are. And I could tell you I'm 27% Native American, 8% African, and the rest is European. And the average African American is 80% African, 20% European. But obviously, there are people like Obama that are 50-50. And the police will treat you the same. And you're right about the skin tone. That's a huge thing in the Black community, and it's been used against other African Americans. Lighter skinned folks had better access and privilege than darker skinned folks, and that's true today, and as evidenced by Kamala Harris's picture on Vogue the other day.
I grew up in Dallas. It seemed like the white population in Dallas had no problem classifying you whether you were white. I mean, it didn't seem like there was even a hesitation. But I think much of it was on the basis of skin color, hair texture, and some what we call phenotypic characteristics. And so consequently, I think that is their argument, is that you can't tell what drug is affecting what person, what outcomes are related to that part of the genome. And the final thing is that we as doctors are not willing to change. But my feeling is this: if you look at one end of the spectrum where you are self-identified African American, you look at the other end of the spectrum where you have poor outcomes, hypertension, diabetes, African American child 30 times more likely to die from asthma than other children. I mean, that means that something is going on in the midst of this whole thing that needs to be improved. So it is irrelevant to me whether or not you have, whether you respond to a certain drug, or whether or not you have a bit and pieces of a certain treatment. If you're Black in this country, self-identified or not, identified by other people, you tend to have poor outcomes for certain diseases.
Yes.
And so
and my colleagues demonstrated that amongst African American males in particular, that discrimination somehow gets under your skin. And we don't know actually how that happens, but we know that it leads to physiologic changes like increased hypertension, increased blood pressure. So it gets internalized. And that's what we call allostatic load. And Dr. Louisa Burrell is my colleague's the expert on that topic, and it's well known.
Well, I think also that Dr. Max Roach, when he talks about prostate cancer, talks about the impact of stress and racism on your immune system. And then your immune system over time, when you're under that much stress, is not as effective as someone who doesn't have that as a burden. My question to you, in some of the final phases of our discussion, or maybe if we have a few questions, Alice, we can take those. My question to you is that how does your study, how does your part of the argument ultimately going to end up in terms of either research or in terms of understanding outcomes for African Americans? Why is this argument important?
Well, as I said, there have been tremendous advances in the last 20 years. Minorities have largely been left out of biomedical research that is funded by the National Institutes of Health, which is funded by taxpayers. So about 50% of the United States is minorities, and they pay a significant proportion of those taxes, including undocumented. And those go to the NIH, National Institutes of Health, and it's incumbent upon the NIH to make sure that we have equal representation so that patients like you and me will benefit from modern advances in medicine and genetics. That's the key thing here. We have genetic predictors for breast cancer that are perfect in white women that are only about a third as effective in Black women. And that's the problem. We need to step up. We need to participate in clinical research. We need to participate in the COVID studies and get those vaccines. And everything that we've seen over the last year, COVID, the insurrection, the conspiracies have affected minority communities in a devastating way.
Alice, do we have any questions from our audience?
Yeah, we had one question here about asthma, so I'm going to put it on the screen there. And this is from Lauren Reed, and she says, "How much do you attribute the environmental factors to the cause of asthma in Black and Brown people?"
It's a significant problem. And that's what we call environmental racism. Black and brown people tend to live in low income areas that are near freeways. And we know that we demonstrated ourselves that air pollution is a big predictor of asthma, but it's not 100% of the picture. And we know that asthma runs in families, which suggests that it's genetics.
Any other questions?
Well, Valerie Green, she was really kind of talking about the prolonged stress, and we all, people are recognizing cortisol
Yep.
released into our bodies and what the damage that can do, and affect our DNA all the way down to the DNA level.
Yep.
And I think that's really what we're talking about in terms of those social determinants of health, is that if we can reduce the level of just racism, whether it's overt in our lives, and we can reduce the levels of microaggressions that people of color face every single day. If we can reduce those levels, then hopefully over time the cortisol levels will reduce in our body and help try to level out some of the disparity when we're talking about health outcomes. I was thinking about my own experiences when I was in grad school studying. Um, One of the things we were studying some of the big psychological tests that they would give to determine if you had a mental illness. And one of the things they would just tell us as just a factor, they would say, well, when you administer this test to African Americans, they tend to score higher on paranoia. And and so one of the things so I'm sitting there and I said, and so why haven't they made that correction? And there was silence. And I said, well, here's the thing. If you're saying that we're paranoid, that puts us on the path that our experience is not real in this country. And we're not paranoid. And as we can see by events over the past 4 years, we definitely are not paranoid. But they built the test that automatically put us high on the paranoid scale, which shows how they see us and how we are experiencing this country. And so when we talk about all those factors, the physiological factors, the psychological factors, the experiential factors that we all have, that I think that's what we're saying is from what's going on in the chat room, that people are saying that is a huge contributing factor to how the disparities in illness.
Can I ask, and I'm not sure I gave Alice, Dr. Brooks the way to get into the chat room, so could you check that for me? One of the things, who's going to win this argument? Dr. Richard, already the University of California, certain other universities around the country have stopped using race as a parameter. I personally think this is a very important battle in order to get to the root of so many other illnesses that uniquely impact African Americans. Who's going to win this, or how do we win it?
I think we win it with people, help from people like you and Ellis Dean, who are helping us to get the word out to the community. It has to be a grassroots, community-based push to get this on the scene. You know, as Ellis had just suggested, African Americans have been labeled paranoid, but there's actually good reason, and we saw that this year. I mean, what a beautiful young man, Ahmaud Arbery, running down a country road on a Sunday afternoon, out for a jog, gets killed. I mean, that, and there's been, you know, with the popularization of rap, everyone wants to be a little bit black now, but no one wants to be black when they're in the back of a police car, you know. So it's alive and well, and people have poo-pooed us for many years and saying, you know, look, you got a black president, we're all equal now. But what we just saw in the last 4 years has been the worst I've ever seen in my entire life.
Well, you know, one of the things that I'm grateful for, if I can be grateful for Trump, is that it was always there. I mean, I grew up in Dallas, Texas, in a segregated community. This is not as bad as it's been. I mean, it was worse then, and anybody who grew up in segregation will tell you that even though this is bad, that was worse. And what he did was he exposed to a lot of here's my biggest issue. He exposed a lot of young people who thought that the transition into amalgamation where we're all created equal and would have each having a piece of the American dream was never on the minds of so many white Americans. And so at least what Trump did was say, hey, this is the way it really is. And I think that we've been able to respond to it. And I'm optimistic. Well, I'm optimistic about the two Georgia senators. I'm optimistic that America elected Biden.
You're welcome, by the way. You're welcome.
Yeah, great. Hey, I tell you, we spent some money down there too. But I mean, we thought it was lost money. But the fact that you in Georgia were able to turn this around was very important. And so consequently, I think this is an argument that I think we have to win. And we have to bring to the point our scientific allies to make certain that we get a fair shake on trying to understand how race and disease come together and to be able to intervene at every level that contributes to that problem. So, Dr. Bashard, thank you so much for joining.
We got one more question for Dr. Bashard. I want to ask this question before we let him go. This is from Lauren again. She had a follow-up question, and really about she wanted some information about COVID and asthma, and as an asthmatic, if she catches COVID, what should she do?
Thank you. You know, I have a wonderful collaborator, Dr. Jose Rodriguez Santana. He has the largest pediatric pulmonary center in the entire Caribbean, and we worked together for about 20 years. And as of today, we have not seen a relationship between COVID and asthma. But it's pretty clear that if you have asthma, you're at risk of having any bad infection, making it worse. And I do like to address Dr. LeNoir, one thing that's different about growing up in a segregated system. At least you knew where the boundaries were. What's happened now is racism has gone underground. And you cannot see who is out and against you, but what Trump has done has given permission to be openly racist again.
Well, I want to stay with you on the same argument, but you just had to grow up in Dallas.
Yeah.
In Dallas. And you would have the romanticism of segregation is just that, romanticism. But thank you so much for joining us, and hopefully this will get people at least interested in the topic. And then we can bring to bear some of the pressures that we need to make certain that we get the kind of outcomes that we want. So thank you so much, Dr. Bashard.
Thank you.
Thank you, Bashard. Dr. Bashard.
Thank you.
All right.
I think there was another question from Yvonne Smith on our YouTube channel, and she wanted to know how are subjects recruited, and I think she's talking about for clinical trials, and that's I'll speak on that from a Black doctor's perspective. One of the things that we have really worked hard on is getting more people of color involved in these clinical trials. And so, as Dr. Bashard alluded to tonight, the world is only 12% white, getting a lion's share of the trials done and the medicine tailored to their physiology. And so if we don't, we understand Tuskegee, I did a whole Facebook Live about what happened with Tuskegee. However, what's really happening here is that when they put out, when they're having clinical trials, they only put it out to predominantly white communities because they know they're going to respond and participate, whereas they don't get as much response from Black and brown communities. And so we've got to do a better job of getting that information out to Black and brown communities about clinical trials going on for research on illnesses and medications, and B, we've got to do a better job of making sure that people sign up and feel comfortable about participating in these clinical trials, because of some of the practices in the past. And so those are really kind of two things of how the subjects get recruited. They're normally through university systems and hospital systems that are putting out the clinical trials happening. And I'll let Dr. LeNoir give a more medical answer to that.
For 10 years, I chaired the National Medical Association's Project Impact to increase the number of African Americans, not only in clinical trials, but African American investigators. I think we have to overcome a lot of legitimate myths about what clinical trials are. A lot of people think that either you get the drug or no drug. That's usually really not the case in this trial. I think the problem has been that there's been such suspicion, and you're right. But I think for the last 10 years, I think most companies have been really interested in getting a representative number of clinical trials in the African American community. But most people don't realize that a lot of the data that we use for the drugs that everybody takes comes from South America, comes from India, comes from other countries, because they can't get enough people in this country. But clinical trials, I think, are very, very restricted to the point where you know that you're not going to be unsafe in any phase of the clinical trial. I'll share my own story with you. I actually had an aortic valve replacement because I had rheumatic fever as a kid. I always knew that was going to happen. And so what happened was I was qualified for a clinical trial where you put in the valve for replacement through the femoral artery. So you have to go through all these things to qualify for the study. And then they flip a coin to see if you get the valve or if they just watch you. Well, hey, I know better than that. They don't have no fool here. I mean, so if you start to have symptoms, then they have to do the trial. But most trials are not like that. Most trials either give you what you're getting or give you something different. But I think we should have at least one session on clinical trials so people can kind of understand what's happening and kind of understand the mission that we really need to get people involved from the African American community in these clinical trials. All right, so thanks, Dr. Bouchard, and I think it's time to update our situation with the COVID virus. Did Dr. Brooks join us yet?
He was, but then he dropped back off. So I think he'll probably be signing back in. While we're waiting on him, I do want to address Dolores. I think she's talking about what she was asking. What does he mean by because of rap everybody wants to be black? And she said she didn't understand that statement. And I'll respond to that one, Dolores. I think what he's saying is that. Rap music it's crossed over cultures and has become very, very popular. And so what has happened is that it's become popular. So now we've got Asian rappers, we've got white rappers, we've got Hispanic rappers, and it's a glamorized industry. Even though it started in African American Black culture there in New York City, it's a glamorized industry. So everybody in that space wants to be black, to be a rapper because it's glamorized, but nobody wants to be black in any other space. And so that's really kind of the.
Who asked that question?
It was Dolores.
Dolores, I don't understand it either. So we have to get a better explanation from Dr. Bouchard about what he meant. But I do think he was right. You don't want to be in the back of a police car. And that part is pretty self-explanatory.
No.
Okay, so now we got to talk about what's going on right now with the coronavirus issue. It's raging throughout the country, no question. I think we're at 376,000 deaths, almost 25 million people have the virus. And the vaccine rollout has been kind of a little disaster. I think the way they did it was they gave the states the vaccine and told them to roll it out. And most states don't have the public health infrastructure to deal with that. I think what most people have to realize is that a vaccine really stimulates your own body's ability to make protective antibodies against the virus. Yeah. The question now is some of these vaccines, the Pfizer vaccine and the Moderna vaccine, both require 2 shots for you to get up to full immunity. Now, the new vaccines that are coming out in March and April are not quite like that. They're kind of the classic vaccine that stimulates you maybe with 1 shot. But right now, the vaccines we have require 2 shots. Clearly, we've only vaccinated, 6-7 million people. We got 20 or 30 million doses of that vaccine out there. My biggest question is that Black people are most at risk. Why was there no national effort to give Black people the vaccine as one of those at-risk categories? I just haven't seen that effort. But right now, we're starting to look at every county, and every state is doing it differently. The recommendation now from the CDC well, maybe from the administrations, is that we just give everybody the vaccine now and worry about the second dose whenever we can get enough vaccine. But my feeling is that, these vaccines were studied as two-dose vaccines. And I've already had my first shot. I don't want to be walking around here half immunized. I hate to be selfish about it, but I want my antibodies rolling hard against this virus.
Yeah.
I think the question for our audience is this. Even if you get the vaccine, and I'd like to get some responses to this, are you going to go back to your normal lifestyle? Or have things changed? Have things ever changed for you? And if I could get some responses to that, I would like to know. From my perspective, I don't know. I'm not so concerned about the vaccine, although I do understand the legitimate concerns of people who don't want to get it. But I don't know whether I'm going to take off my mask. I don't know whether I'm not going to social distance. I don't know if I'm going to any concerts for a while. I don't know if I'm getting on a plane. I may have to take the bus or the train, and I have to look those over first. And so I don't think my lifestyle for many, many months, unfortunately for me, because I do like to travel, is going to change. And I wonder what other people who've gotten that shot feel about that. But I do think that it's been a bit of a mess. And
I think it's a good question. In terms of getting the vaccine, and I produce a number of these events on Black Doctor. In terms of getting, that's one of the pushes that we've been really kind of focused on, is making sure there's equitable distribution of the vaccine to communities of color. So because we know how much we are involved in terms of being on the front lines of being essential workers in this country. So communities of color, and especially with comorbid conditions, need to get this vaccine in order to, if we're looking forward to trying to return to some sort of whatever, however you define normal life. The second thing is, Valerie, I want to talk on our YouTube page. There are some short videos of Dr. Corbett talking about what's in the vaccine per se. mRNA technology is not new. I just want to say that for our audience. mRNA technology is not new. It's been around for a number of years. What has happened with this particular vaccine development is that we combined, they combined multiple technologies.
No, let's take credit. Let's take some credit.
I'm not a doctor. I'm not a research
That's
doctor.
all right, man. Let's grab some credit on this.
Multiple technologies have been combined, and that's how this vaccine process was able to be accelerated. The coronavirus has been studied for over a decade, not this particular version of it, but the coronavirus itself has been studied for decades. So we already had a knowledge base about the coronavirus. We already had the technology, the mRNA technology, to be able to deliver a vaccine in this manner. And we just kind of put those two things together to be able to deliver this vaccine. So that part of it is safe. And there's also some additional information on the site that can talk about specifically what's in the vaccine.
Yeah, people have to look at it like this. The coronavirus is a category of viruses. I mean, the COVID virus is a unique coronavirus. And so what happens is this, is that it's like a tree. The trunk of the tree for coronavirus is the same. The branches are different. So that if you can make it's like a woodsman, right? I guess a woodsman, as I understand it. If you're a woodsman and you want to chop a tree down, then you start at the trunk. And that's the same thing. You're right. We've been looking at coronaviruses for a very long time. Mm-hmm. So that the fact that it was accelerated, it was only accelerated by the fact that we spent so much time, working on coronaviruses. And so consequently, what people have to understand is that this is not a new virus. I mean, the category of viruses. This may be a unique virus, but it's not a new category. Yeah. And I think that those of us who have chosen to get the vaccine, I mean, let me tell you about my journey to this vaccine. I decided a long time ago I was going to get this vaccine, simply because I made the choices based upon my own experience. All right, so when the vaccine came out, I immediately looked for any category I fit in to get me the vaccine. Now, I have babies in and out of the hospital, so my hospital was going to give me the vaccine. 3 times I filled out the form, and when I finally got down there, they didn't have the form. So they were going to send me home to fill out another form Of course, then I jumped ethnic on them and said, look, no, no, no. I filled out these forms 3 or 4 times and I need to get, so I had to sit there for another 35 or 40 minutes filling out forms. And so there are all these barriers to getting the vaccine that everybody wanted so badly. But I think over the next month or so, we're going to start to see some acceleration of the vaccination program. But I'm still wondering what happened to that whole issue of emphasizing the African American community as one of the high risk groups.
Sorry, I was pulling up the video because I think we can play it. It's Dr.
Right?
We have the video of Dr. Corbett, Kismekia Corbett. She works at the NIH underneath Dr. Fauci, and she was instrumental leading the team of doctors that created the virus, the vaccine. Sorry, not the virus, but the vaccine that was developed by Moderna. But some of the answers to your question about what are people going to do, Eunice says when 80% of the population gets the vaccine, that's when she'll start back traveling, going to concerts. Candace says, same here, Dr. LeNoir. I will definitely not be quick to jump back into business as usual. Sharon says, I'll be wearing a mask for a long while, even after the vaccine. So I think Sean is saying getting the vaccine is helpful in stopping the spread, but let us not mistake that it's all clear to go back to regular life. This will still take months, given how others are still not taking this seriously or any precautions. So I definitely, feel that's what exactly what people are saying the same thing that yeah, we can get vaccinated. The vaccine doesn't stop you from being infected. It just kind of helps you survive the infection. And so we
Well,
have to still take precautions.
to talk about herd immunity, I want people to understand that smallpox vaccine has been around for 50 years.
Mhm.
And in fact, in 1947, when they had the big smallpox epidemic in New York City, they started vaccinating people. The last case of smallpox disappeared this year. So that this virus is going to be around us for a very long period of time. And so consequently, I can say herd immunity, I'm not sure it's going to happen in any immediate space. So if you're waiting for that, I think you're in trouble. One of the things that I've seen as a pediatrician is I've heard every argument as to why they didn't want the child vaccinated. I
Right.
mean, the mother didn't want it, and the father did. I've seen everything happen. And at the end of the day, California said, no, you can't do anything without getting vaccinated. And that changed the whole dynamic. But I'm telling you that that don't wait for herd immunity.
Right.
That's not going to help. You have to make it, and the reason I'm saying that is not to convince you about the vaccine, but to give you another piece of information that if you think it's going to be herd immunity that protects you, I think you're going to be very wrong about that. You got
Yeah,
the
and I think it's a multifaceted approach. What we really kind of had said, and what I've been saying when people ask me individually, is I say it's a multifaceted approach. It's not a silver bullet that's going to save you. So the vaccine gives you some protection. There have been stories going around about taking vitamin D. And vitamin D is important because Black people are typically, deficient in that vitamin, and it does. And they're showing that people that have severe reactions. There's been some studies that show that people have severe reactions from coronavirus are vitamin D deficient, and so it won't hurt. So if you take
no,
D and C, that's not going to help, but it's not going to protect you from coronavirus. It can help your body, and as well as with the vaccine, to strengthen your body to be able to withstand if you are infected. But over time, we're just going to have to be used to mask wearing, hand washing,
I noticed. I
social
noticed.
distancing as much as
But
possible.
I noticed the mask have become a fashion statement. I got a little paper mask, but I'm gonna step it up in the
I've
next
got
couple
several
months.
masks. I can see you some. I got some. I got some designer masks.
Yeah, yeah,
I got to match my outfit. I got to keep it clean.
it's definitely become a fashion statement. Do you have that video? Were you able to bring that up?
I do. I have it right here. I'll go ahead and pull that up, and so we can watch this video. Um,
So in studying that and making vaccines for MERS over the last 6 years, we also partnered with Moderna, which is which was at the time actually a very small biotech company, but has since then grown to be larger. But they use a platform called messenger RNA. And together with our understanding of how to make spike proteins and their platform messenger RNA, we had this large package of data that really allowed us to drive this rapid vaccine response. So what you're seeing in front of you, by way of media and otherwise, is 10, 11 months of vaccine development. But the preclinical science that drove this vaccine development extends even beyond my tenure at the National Institutes of Health, even up to 10 to 15 years, starting in the days of the SARS coronavirus. So there's a large amount of research and science that backs these vaccines. That's the first part. And then the second part is that this is the most devastating global health crisis in the last 100 years. And there is likely no other way out of it at this point than a vaccine or some really critical medical intervention.
BlackDoctor.org, where wellness and culture connect.
Yeah, see, I think that shows you. I think
substance to the conversation. The conversation is about.
Oh, she's still going?
No, it's something else. Sorry.
All right. Well, I think that what this shows is that we have African Americans throughout the whole system, and everyone is concerned about your response to the whole issue of vaccinations and the like. My best advice, and I will consistently say this, is get as much information as you need to make your own decision. But I do think that there's some things about this particular vaccination program that is very different. And so I think right now, what we look for, once everything clears, next week, we don't know what's going to happen, but once everything clears, I think you're going to see a much more advanced rollout on the vaccination front. And I think what people don't realize probably now, that in March and April, we'll have a couple of new vaccines that are going to be one-shot vaccines, easy to mobilize, and those, I think, are coming through. But in any event, I think we do have to protect one another. I think we do have to remember that social distancing, wearing a mask, keeping your hands washed is going to be around us for quite some time. And I hope that we're able to make the case that whatever you do, you should be consistent about it.
Absolutely.
So, anything else we need to talk about here, else?
I think so. I don't know if Dr. Brooks is. He may have gotten caught up and he can't join us tonight. But I just will continue to reiterate. Stop by blackdoctor.org. We have a COVID channel dedicated. You get up-to-date information about the vaccine, about the distribution, about the actual virus itself. So there's a wealth of information there, as well as a host of videos on our YouTube channel. So you can go to the BlackDoctor.org YouTube channel as well and get some videos there. And then, of course, Dr. LeNoir and I will be talking about it here regularly about coronavirus on this programming every Tuesday at 9 p.m. Eastern, 6 Pacific. So you will be able to get all the information you need to make an informed decision for you and your family regarding this vaccine. But please stay safe.
And I want you to go to our website at awellnessproject.org. Or listen to our podcast at Black Doctors Speak. We talk in more detail about some of these issues and some of the things we talked about tonight. So awellnessproject.org. All of our programs are co-sponsored with blackdoctor.org, and our podcast, Black Doctors Speak. And I want you to remember that obviously we always say the same thing, that health is your biggest asset. Next week we'll be talking about compassion. Right now, Alice, I don't know what that means, but I'll know by next week.
We're finding it. We're finding it. I actually looked it up one time for a paper I was writing. We're finding compassion. I think that we needed a wake up. People don't change. People change on dramatic events, and so that what happened on January 6th was a dramatic event, and I think that is going to be the catalyst to having some significant change, hopefully, in this country. We needed that dramatic event in order to change.
And health is your biggest asset, so protect it.
Good night, y'all.